Hey guys, Dr. Don here with the Wellness Way South Jordan. So the number one cause of hypothyroidism, what do you guys think it is? And it's not even close. It's not even close. It's estimated to be 90% of all hypothyroidism cases in our country, in the US, is driven by Hashimoto's disease. In the early 1900s, Dr. Hashimoto found this disease. He named it after himself. Okay, so Hashimoto's disease, it means that your immune system is attacking your thyroid. So there's two different antibodies that you can test for to see if you have Hashimoto's disease. Now, if one or both of these antibodies are above the laboratory range, then we can consider that a positive test for Hashimoto's. Unfortunately, there's a lot of what's called false negatives, and again, estimated to be nearly 40% of the time when this test is negative, it's a false negative, meaning that you truly have it because your immune system flares up, calms down, flares up, calms down. So if we test these antibodies in more of a calm down state, a lot of times they'll be within the normal range. But classic appearance and the kind of how this story goes, and it hits really close to home. The first patient I ever had was my mother. She dealt with hypothyroidism and Hashimoto's disease for 25 years before I helped her with her condition. And the way it started is she started having symptoms. She started being fatigued, and this was in college. Started being fatigued, started having some bowel issues, started to put on weight, even though she was very, very active. Goes to the doctor, they check your TSH. Yep, your TSH is high, so you have hypothyroidism. Debbie, we need to put you on a thyroid hormone replacement. So at, I believe it was 18, 19 years old, she started thyroid medication. Well, it worked a little bit over the years, on and off. The medication dosages were changed. She'd go in for a checkup. There would be a change in her TSH, so they'd either lower or increase the medication. But over the years, the medication slowly increased. There was changes up and down, but overall, the medication increased. Until she found out one day, because she saw more of an integrated type of doctor, that she had Hashimoto's disease. Went back to her endocrinologist. Her endocrinologist says, yeah, but that's not really going to change our course of treatment. You still need to take the Synthroid. She said, yeah, I know, doc, but my symptoms are getting worse over the years. Well, let's just keep you on the medication. Maybe we need to increase the medication. Let's go ahead and run some blood work on you. But again, guys, if the immune system is the problem, just by taking a thyroid hormone replacement, that's not going to make the symptoms go away more times than not. And unfortunately, the immune system is continuing to be out of control. And this is why we see in a lot of cases, one autoimmune condition leads to another. And this is when she started to develop rheumatoid arthritis because her immune system just moved on and started to attack her joints. So guys, get tested. If you're having thyroid symptoms, make sure your doctor's running those antibodies so you can rule in or rule out Hashimoto's, and then we can start addressing the issues that are causing that in the first place.